Hello, my name is Lovely, and today I will be demonstrating how to do an airway, securing the airway, using the Anchor Fast Guard. And indications for this procedure is to provide ventilation, support ventilation for the patient, and also for suctioning and to prevent any obstruction in the airways and to keep the airway glands open. So I will go ahead and introduce myself to the patient and tell them what department I was from and what we will be doing today and what the procedure would be like. So I'll go ahead and sanitize my hands for 15 seconds vigorously and let it air dry. And I will go ahead and apply my gloves. While I'm applying my gloves, I'll make sure that I have all of my equipment already assembled that I will be needing. I have my ambu bag just in case we need to ventilate the patient in between, and I have my 4x4 gauze. I have my bite block just in case, and I also have my ankle fast guard as well in the box. Of course, all of this comes together in the box. And I also have my CO2 detector, saline bullet, and my syringe if I need it, and an extra suctioning kit just in case I need it. So I will go ahead and assess the patient, do his vitals, and make sure he is ready for this procedure. So then I would go ahead and check the patient's ET tube and make sure that the size of the ET tube is correct and where it's supposed to be. So right now it's at 22 at the lip line, and the size of the ET tube is 6.5. So we'll make sure that is secure, that is fine where it's at, and we'll make sure that the cuff pressure is where it's supposed to be. So we would use our cuff pressure monitor to measure the cuff pressure and make sure that it's within the green, which is where it's supposed to be, less than 25. In between there, 25, 24, and right there. So we'll go ahead and make sure that the patient is ready. We already assessed the patient and his vitals. So my assistant is going to come in and help me. So while she's coming, I'll go ahead and be rubbing this on while she's putting on her gloves. And if the patient were to have any facial hair or anything like that, we would want to make sure we shave it all off, because we wouldn't want the hair to be sticking on there later when it's time to take it off. So I will go ahead and have these right there ready. So then I would be making sure that we're holding this part, the ET tubes, and clipping the bite block around the ET tube and making sure it's in between the patient's teeth, and with doing this without moving the ET tube any further, because the ET tube is supposed to be between 4 to 6 centimeters above the carina, and that's exactly where we want to keep it. And once we put this on, we want the sponge that's in between this to be in between the nose and the upper lip line, and that's right where it's at right now. So we're going to go ahead and reconfirm the tube positioning. It's still at the 22 mark line, so that means we haven't made any movement. So while she's holding it there and warming it up, so I'm gonna get the strap ready and lift the patient's head and put it around his head while securing the airway. She's gonna go ahead and secure and hold the airway right there. So while she's holding this part, I'm gonna go ahead and make sure I put this around to hold it in there tight. And once you hear the click and you know you have put a tight seal around the ET tube, and now it's secure and it should not be moving. So we're gonna go ahead and double check our tube positioning again. Now that we have this around, we're gonna hold this just in case the patient try to reach and pull it out, and try to put the strap around through. And we're gonna make sure we have 2 to 3 finger spaces in between, so that way it's not too tight. So we have already peeled off these tapes that were on here, and we already stuck it to the patient, which is why we were warming it up to make sure that the adhesive is soaking into the patient's skin so it can stay. So now that we have secured the airway and it's stable, we're going to make sure that the patient is stable. We're going to check his vitals again and make sure that his vitals are fine. So check his blood pressure, not blood pressure, but heart rate, breath sounds, and we're going to do a chest assessment as well to check for chest rise. And another way to confirm that you have done this properly as well is to get a chest x-ray. So we'll go ahead and get a chest x-ray done as well. So then you want to go ahead and check the cuff pressure again to make sure that the pressure didn't go up or down. So you would use your pressure manometer. And then from there, if the patient looks like he needed to be suctioned, you would have to connect your suctioning to the ET tube, and if you needed suctioning, and we did bring our sterile water bullet with us, so if he needed it, we would go ahead and pour some in there and go ahead and suction him. But right now he's doing fine. We listened to his breath sounds, so he doesn't need to be suctioned at the moment. So we'll go ahead and take the cuff pressure manometer off and away. So from there, the patient looked like he's doing fine. So we will go ahead and document that, and that'll be all for this part. So from there, we would go ahead and do our next step. If we had a trach patient, we would the only difference would be, I'm just gonna go ahead and take this off. Oh, one more thing before we go to our trach patient is you wanna check the CO2 level as well, if just to make sure that your levels are within ranges. So you would need your CO2 detector. Since we have it right here on the table, we have it with us, so you would use it and check to make sure that the CO2 detector is fine. But there are risks, if I forgot to mention those, which also are a similar thing for the trach. Risk of not securing the airway can be the patient can cough and cough it all out, and then you would have to re-intubate the patient again. Or the patient can pull it out by accident or push it in, and that would be damaging the airway for the patient. So now we're going to go ahead and go to our trach patient if we were to have a trach patient. So if we were to have, so for our trach patient, we're just gonna disregard that part. So for our trach patient, we're going to, the main indication for doing this part, the trach, is to, of course, secure the airway, but also to support ventilation, and to facilitate easier suctioning, and also for it provides to keep any airway obstruction from the patient as well. So from there, we have our trach in. We're going to make sure that to see what size we have. So we have a size 8, and it's a Shiley. So this is fine. So we're going to make sure we check a cuff pressure, and make sure that it has the right amount of pressure, just like we did for the ET tube. So then we're going to go ahead and get our neckties and hold it right there, and then put this around the patient's head. Now, if the patient didn't have a pillow or needed something under his neck or behind his head, we would use a towel and put it under his neck for more comfortability, really, to make the patient a little bit more comfortable. So we will go ahead and put a pillow, a towel, extra towels behind his head, so that way we'll have better access to it. So we'll make sure this is just like that. So as you can see, she's holding the airway and it's secure. So we'll go ahead and make sure we put this through the the flanges and tape it on there. We're going to give the patient 2 to 3 finger room, so we don't want it to be too tight. Alrighty, so still holding it right there without letting go. So we'll go ahead. There we go. Okay. So we still have our finger spaces there, so we know it's not too tight or too loose. And if it was too tight or too loose, you would just go ahead and loosen it up or tighten it if you needed to. So we're gonna go ahead and check our trach again and make sure that it did not move or come out of place. Okay. And if the patient also needed to be suctioned as well, you would just go ahead and put your suctioning, your clothes in my suctioning it. So make it as sterile as you can. And then from there, you would just go ahead and put in your sterile water and suction the patient if he needed to be suctioned. So since the patient does not need to be suctioned at this point, he is fine. So you would just make sure you secure the airway, make sure it's your cough pressure are within ranges where they're supposed to be. From there, you would go ahead and reassess the patient and confirm, reassess him and make sure you repeat all the vital signs again and make sure that you have bilateral breath sounds and you have chest rises and he doesn't need to be suctioned or anything. And then from there you would, okay, so patient is now comfortable, so you will go ahead and clear out your equipment and take everything that you do not need anymore out of the room, and you would say goodbye to the patient. And then from there you will go ahead and chart everything that you have done and remove your gloves, and you would go ahead and sanitize, and that's it.